Orthotics for plantar fat pad atrophy, and what do we do when the fat pad wears out on the bottom of our feet? So it's a common problem that we get that as we age, the fatty pad or the cushioning section on our foot. So if we take a look at the foot model, if we overlay the skin and muscles and ligaments and everything on the foot, in the forefoot and the rear foot and across the whole plantar surface or the bottom of the foot, there's a really quite a thick fatty pad and its function is to cushion the foot. So we don't want the bones resting straight on if we're walking on concrete or a hard surface, because this would lead to too much shock going through the foot and you'd lead to an overuse injury. So basically what we have is under this whole surface is a fatty pad, just like a sheet, almost like a neoprene, that runs the whole distance of the foot, and it can be up to 1 to 2 centimeters thick. And unfortunately, the more repetition with walking that we do, and the older that we get, this fat pad is more likely to wear out. So the fat pad can actually break the little membranes that hold the fatty pad in position, and the fat can squirt out. So what that leaves us with is underneath the heel, where we might have the fatty pad being held in position, the fat can actually squirt out to the sides, and then the bone starts to contact the ground. Now, this is more common that we get plantar fat pad atrophy in diabetics or people with connective tissue disorders like lupus and scleroderma. It's also more common in people with higher arched feet. So if we really exaggerate the arched foot, we can see that this portion of the foot and this portion of the foot are going to bear much more weight when we're walking. So we're more likely to wear out the fatty pad with just direct mechanical force, even if we don't have any underlying systemic disease. And we're more likely to get plantar fat pad atrophy in these positions. You can often see it in elderly patients with you can see in their forefoot, under each one of the metatarsal heads where they bear weight, the fat pad has degenerated and we get corns and calluses. You can see that in our YouTube shorts that we do callus removal in these areas in particular. So what do we do to either prevent plantar fat pad atrophy or treat plantar fat pad atrophy? So what we do, the first thing that we try is prevention's obviously better than trying to fix it after the fact. But if we use a soft arch supportive orthotic innersole with, obviously we've got the cushioning positions in the right areas where they get the highest pressure in the feet. So this orthotic innersole is designed around supporting the arch. So if we can take some of the weight or even the pressure out under the foot, so we don't have any areas of really high pressure here and here, but it's all through the arch, this can help to reduce the degradation of the plantar fat pad. So that really helps not to wear it out too quickly. The other thing we do is we use a soft orthotic innersole like this. This is the one we use most in the clinic, the Ergonix Ultra Soft. And what it does, it supports the arch, but it's also got this really nice cushioning. So this actually tries to do the work of the plantar fat pad. So we've got it right down to the front, it's nice and soft all the way from heel to toe. And so as your foot heel strikes and moves forward onto the toes, it cushions the entire length of your foot and will help to take some of the strain off the plantar fat pad, so you won't get as much degeneration or wear and tear on the plantar fat pad, and it'll last you longer in your life. If you've already got plantar fat pad atrophy, we do the same thing. We just try and replace the work that was being done by the plantar fat pad in your foot, rather. We try and do it with the orthotic innersole. Now we use this in cooperation with a great walking shoe. So we want to have a shoe with a really nice midsole. So if we have this is a Brooks Adrenaline. So if we have a shoe with a beautiful sort of soft, but yet not too soft midsole, that will actually help to do quite a bit of the cushioning that your plantar fat pad would usually be doing. And then if we also put a soft insole in there to hold your arch up and cushion the foot even further inside the shoe, this replaces the job of the plantar fat pad, and you'll maintain the little bit of plantar fat pad that you have. If you're working on a job site, we have a arch support work boot with an orthotic insole built in to do exactly this. And this will just mean that if you're not elderly, so if you're a younger patient, we try and get you in the right footwear to cushion and support your feet before the fat pad wears out, so you don't ever have to deal with the problem. A good method to see if you're actually going to suffer from plantar fat pad is look at your parents' feet, look at your grandparents' feet, and usually you would have inherited your feet from either your mother or father's side, and you're going to inherit one of the, either mum or dad's feet. So looking into the future is just looking at your parents or grandparents' feet. So that's basically what we do for plantar fat pad atrophy. We support and cushion the feet and try and prevent it. If you have any questions on this, please don't hesitate to ask, but we look forward to seeing you in the next video. If you enjoyed this video, please like and subscribe to our channel. It's very simple to do and it really does help us out. If you need further information on the topics discussed, please follow the links in the description, and that will take you to our website where we've got more information on these topics. If you have a specific question that you'd like to ask, please comment in the comments section below, and we'll do our best to make a video to address your question. If you have any further comments or questions, you can find us at ergonix.com.au, and we look forward to seeing you in the next video.